Welcome to the Dana and Dr. Pearl Show, where we tackle issues affecting homebound seniors. I'm Dr. Cheryl Pearl, and I'm a home care physician making home visits for more than 25 years.
And I'm Dana Arnone. I've been a registered nurse with a focus on home health care for 30 years. In today's show, we are focusing on senior mental health and adult services in Nassau County. We have a very special guest today, Lisa Stern. She's the Assistant Vice President of Senior and Adult Services at Family and Children's Association.
And in our Ask Dana segment, we answer your most commonly asked questions. So, Dana, today we're talking about mental health and seniors and the available services for them in Nassau County on Long Island. I honestly believe about 25 to 30% of our seniors suffer from some mental health issues, and there are some resources that I know of, but not a lot. It's very hard, I find, for seniors to get out and get to see psychiatrists, and there are only a few that do telemedicine visits. Mm-hmm. What's your experience?
Similar. It's hard. We make referrals a lot for our families to social work therapists that have their, their own practices. Right. They're limited in their abilities to visit patients in their home, especially now, but they're limited as to the insurances that they accept, because primarily they accept as Medicare as a payer. So I find that it is a struggle. We call and we refer out a lot. So I think having a service like Lisa Stern's service that we're going to talk about in a little bit is important for people to know that they can access it, because a lot of times they don't realize maybe just having someone to talk to, or having that social worker or that therapist to have those conversations. It helps the families as well, not just the patient. We actually have a couple patients on service now with a group, and they see our patient as well as the family. So it works out pretty well. I find that a lot of times people are afraid to go into someone's house, or someone's afraid to receive someone in their home, so they're all going to like telehealth and other ways of communicating. So do you find that your patients use telehealth? Or do you use telehealth?
Well, I think part of the thing that has prompted the change, of course, is that Medicare announced new coding when COVID hit, so that people could access care without necessarily going into their doctor's office, which then allowed physicians to provide that service. So you do have a lot more physicians offering telehealth. Now, what we do is I will speak with patients on the phone and I will treat them. And if I have on occasion given them my cell phone and said, look, you can FaceTime me, show me the rash that you have, or send me a picture. But we still want to see them every 6 months, okay? Because just telehealth, to me, year-round is not ideal.
Yeah. Well, I'm curious to find out from her if they go into patients' homes now.
There are a number of mental health counselors who will go in and help our seniors either on the phone or through in-person visits. Even with COVID, they wear masks. And I can't wait to come up after the break, because we're going to meet Lisa Stern, who is the Vice President of Senior and Adult Services at Family and Children's Association, and we'll be talking to her about mental health.
The COVID-19 vaccines can be our chance to get back to our plans, who we are, what we miss, to get back to each other, to life. But it's okay to have questions, like, how were the vaccines tested? In rigorous clinical trials among adults of diverse backgrounds. Can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Why should I get vaccinated? Protecting yourself also helps protect the people around you. Find the latest information at getvaccineanswers.org.
If you're looking to a profession in healthcare, Reliance is the best place to be. I believe that being an healthcare aide is what helped me get into nursing school. As an $11.99 union agency, aides can get tuition reimbursement to help with their career growth.
Reliance, how can I help you? I'm a college student. I work as a healthcare worker in assisted living. My major right now is business management. Hopefully in the future I can go for public health administration.
I was a single mom, so I was looking for a career that have a flexible schedule, hourly, overnights, or just weekends. You can be with your kids, you can work, you also can go back to school if you want to. This job offers a great work-life balance.
Join a company that values you and the professional that you are. Call 516-304-4757 or email us at recruitment@reliancehss.com.
At Medical House Calls with Compassion, our mission is simple: provide the highest quality and compassionate care for our patients. Our team has been treating patients from 18 to 100 plus for nearly 20 years, specializing in primary and preventative care, homebound patients, geriatrics, palliative care, and hospice, all in the comfort of our patients' own homes. Medical House Calls with Compassion, providing you with the best practitioners for the best care.
Welcome back to the Dana and Dr. Pearl Show. Today, we're focusing on the mental health and adult services in Nassau County. We have Lisa Stern, who is Assistant Vice President of Senior and Adult Services at Family and Seniors Association with us. Thank you, Lisa, for joining us.
I'm so happy to be here to share our information with you. FCA, Family and Children's Association, has a very vibrant and comprehensive senior division. We try to work with seniors in the community and really target what their need is.
And when you think of mental health, what are the biggest issues that you see?
We see a couple of different scenarios. Some people have been struggling with mental health issues throughout their life, and they now are older, and it's more difficult for them to connect with counseling, to get to their doctor's appointments. Their medication needs change. So we really try to connect them with long-term care resources so that they can stay safe and independent living in the community. Then we have some seniors that, through losses and changes in their physical issues, suffer from depression or anxiety, and we try to offer them counseling, connect them with counseling. I think there's a lot of myths about seniors, that seniors, as they get older, have depression and anxiety, but seniors are very resilient, and that is not the norm. And seniors also can make use of counseling services.
Absolutely. I agree. Now, when you have a senior and you refer them for these services, do they need to go out, or are these telemedicine visits? Are these in-home visits?
So our linkage project, which is for mental health counseling, it's short-term, 3 to 6 months. And during that time, we try to build trust. We try to connect them with long-term care resources for counseling in the community.
During COVID, and you're talking about mental health issues, I'm sure that COVID is bringing out maybe some mental health issues that weren't there before, maybe some underlying diagnoses in people. So what has changed in your practice prior to COVID to now?
Yeah, COVID has been really difficult on the senior population. They're homebound, they're isolated, there's depression, there's loneliness. We've been working with our clients on check-in calls constantly. We do have some Zoom for people who are affected by COVID, where they can go on and talk about what their issues are. We also did a telephone conference call for clients of the agency who were suffering during COVID. The good old-fashioned telephone for a lot of seniors is what works best. A lot of seniors are not connected to the internet.
Right.
So that's been a challenge. But again, the check-in calls have really been helpful. We have our friendly visiting program, where we have volunteers that connect with the seniors on a weekly basis. Sometimes even 15 minutes of a call during the week is enough to reduce loneliness.
You know what I was always wondering is that a lot of the seniors were going to social daycares and medical model daycares, and since they've closed, they're in their homes now. So have you seen an increase in your friendly visitor program? Or
Yes, we definitely have. A lot of the matches that existed pre-COVID were stronger than ever during COVID. We had to really review safety protocol with our volunteers and our clients because they wanted to continue that relationship. But we've gotten a lot of influx of calls, and our friendly visitors have also taken to delivering groceries for the seniors, so they've kind of transformed their role, as have our chore workers to help during COVID. But loneliness, there was a Michigan study that loneliness has increased so much during COVID, and we know that loneliness affects the physical and the mental health of our seniors. And we're strengthening that program now as well. But again, it was all hands on deck during COVID. At the height of COVID, I think we made 3,000 phone calls to seniors just to make sure they were okay, to see if they really, whatever they needed. And mostly we found food insecurity was a major issue during COVID.
Right, yeah, that makes sense.
Yeah.
I was going to say, I find that so many seniors are declining mentally as well because of COVID, because they're just isolated.
Yeah.
I almost feel like it should be a daily visit. You don't have the staffing for it.
We don't have the staffing, but the Nassau County is amazing. All of the programs have a lot of Zoom and online resources for seniors. There are support groups. There are, helping seniors even connect with the internet, who never connected with the internet before.
Right.
And through our linkage project, that is a major focus of that program too, to connect seniors with other means of communicating.
Tell us a little bit, what is the linkage project exactly?
The OMH Linkage Project, it's funded by the Office of Mental Health, and it targets seniors who fall through the cracks, who need a little help connecting with the resources in the community. So it's an intensive case management. It's also counseling for seniors on a 3 to 6 month basis. We try to connect them with long-term care resources. This helps seniors who might be homeless. This helps seniors who just are having trouble navigating and connecting with Medicaid and connecting with health insurance counseling and all of that. So it's really intensive case management along with building trust, which sometimes takes a long time for people who are
Right.
suffering with mental health issues.
Where do you get most of your referrals from? The family themselves, or Adult Protective Services? Like where are
All
people?
over. It could be Adult Protective Services. We work closely with Adult Protective Services when necessary, but we discharge planners in hospitals because those are the frailest seniors that are coming home. We do a lot of outreach to the senior centers. I'm on the coalition, the Senior Coalition in Nassau County, so we have connections with a lot of community organizations. So we get referrals from seniors themselves. We get referrals from family members and concerned neighbors. So we really do try to do a lot of outreach and promoting of our program.
Yeah, I don't think that people realize that these services are free to them as well.
Yes, there's no charge for the services. They're grant funded. Also, the Office for Aging has New York Connects, which connects people with a lot of resources throughout Nassau County.
What about if someone wants the mental health, the 3 to 6 month in-person therapy? Is that a Medicare payer, or is that free as well?
No, it's a grant funded
It's a
by
grant,
the
so it's
Office
all
of
paid
Mental
for.
Health. Yeah,
And-
and we try to connect them with the long-term care resources.
Do you have any psychiatrists that will see them via
was gonna ask that.
telemedicine? Because we have wonderful therapists, but I don't have any actual psychiatrists.
Yeah, no, we do not have any in-home psychiatrists.
I think that people don't think or understand that loneliness is, part of the healthcare. Because what we talk about in our office all the time is that if we can't get an aid to a patient's house because of where they live or the distance or in their certain areas, just having someone come and say hi can make the difference of someone, staying in their home in a positive environment versus maybe going to the hospital or a nursing home. So I think the friendly visitor, I always wanted to start that too. So these people, are they seniors that go visit people? It could be anybody. Like how would someone, do you take volunteers all the time? Can someone sign up to be a friendly visitor?
Anyone can sign up to be a friendly visitor. We do a background check.
Okay.
And actually that program is funded by PSCG.
Oh.
Yes, Long Island. So we're really grateful. And some of their employees have become friendly visitor
I
volunteers.
could see that being a positive thing. It would
Yeah.
and it's a feel-good thing. It's not,
Yeah.
it's not
And we really pay attention to how the matches are made. It has to be as rewarding for the volunteer as it is for the senior.
Right.
So we try to match people who live nearby, because sometimes driving is an issue for our volunteers too. And we try to match people with common interests.
I like that.
We had one gentleman who was actually a friendly visitor. He spoke Italian. So he was delivering to his client the groceries during COVID, and he spoke in Italian to her, and it was so comforting to her.
Yeah.
So the visit for the groceries became like something she looked forward to.
That's nice. Lisa, we're going to hold that thought and we're going to come back to continue the conversation. But first we're going to take a break, and coming up next is our Ask Dana segment. I'm going to answer your most commonly asked questions, and then we're going to continue our conversation with Lisa Stern. Welcome back to the Dana and Dr. Pearl Show. It's time for Ask Dana. So I've received some questions after our last show that we'd like to share with you. One of our questions was that people were asking about elder abuse and how to access information in reference to elder abuse. Of course, you can call Adult Protective Services. You can definitely call your local police department. But we also found in September, Family and Children's Association hosted a virtual event on Elder Abuse Awareness and Prevention Conference. Identify contributing factors of elder abuse, connect with helpful community resources, and empower older adults to protect themselves. The virtual event was recorded, and we can share the link, but it does offer important information for families or for neighbors or just for people that might suspect some elder abuse in somebody's home, that you can just look for some type of community resources to help them. Seniors represent a growing proportion of residents facing anxiety, depression, suicide, alcoholism, misuse of prescription drugs, and isolation from help. If you know anybody that is suffering from any of these issues, we'd like to share the phone number with you that they can access some help, and it's 516-292-1300. I know a lot of times people are afraid, even in my office, if they're suspecting that there's some type of abuse going on, people are afraid to make that phone call. They're afraid of getting involved. They're afraid of the consequences. I can share many stories with people of times that we've called Adult Protective Services and stepped in to help families, and a lot of times it determines whether that person is staying home or is hospitalized. So, you know, the thing that they say, if you see abuse, you should report it, because if you don't, you're just as guilty as the person that is doing the abuse, my opinion. So another question we got was, my dad was always an avid reader and he's having issues with his vision. What can I do to help him? There is a audio book app. It's called Home Player. It's specifically for seniors. It's extremely easy to use, because I know sometimes people say that their family or their loved ones don't know how to access apps on their phone. This way your dad can still experience the newest bestsellers. At the end of our show, we'll share that link with you, and then you can share it with your loved one. And let's not forget that maybe sometimes the grandchildren can spend a little bit of time with their grandparents, even over the phone, or maybe a pre-recorded message, and I'm sure that they would love to be able to see their grandchildren reading to them. I know I would, one day soon, I hope. Well, that's all the questions we have for Ask Dana this week. If you have any questions that you'd like me to read on air, you can feel free to email me at info@allthingshomecare.org. After the break, we're going to continue our conversation with Lisa Stern from Senior and Adult Services at Family and Children's Association. We'll be right back.
Welcome back to the Dana and Dr. Pearl Show. We're talking with Lisa Stern, Assistant Vice President of Senior and Adult Services at Family and Seniors Association. We just spoke about seniors' mental health and the many programs available at their facility. So, Lisa, I have a big doozy one for you.
Okay, bring it on.
What do you do about the seniors who have difficulty paying their bills and dealing with all the phone calls that come in and scammers that call? Constant. Yeah. It's constant, because I've been in the homes and the phone rings every 20 seconds and it's someone else harassing them.
We've seen a tremendous influx in scams. Pre-COVID, we did a lot of presentations on scams, the most common scams, and there have been COVID scams. Our counselor will talk to any senior that feels there was financial exploitation. They provide complete support. So whether you need to intervene with the bank or the police, we provide that level of support. Pre-COVID, we went with the client to the police. We actually did all the contacting and collaborating with the banks to see how they can get reimbursed. We also apply for restitution for what they might have lost. So it's a lot of hand-holding through the process.
And how do you work with these seniors to prevent further financial problems?
Training. We do a lot of outreach, a lot of presentations. We've been doing Zoom presentations throughout the pandemic, warning seniors how, what is coming down the pike, what the scammers are so incredibly great, especially for lonely seniors, and engaging them in conversation. A lot of seniors stay on the phone because they're lonely and they just want to talk to someone. And they're very...
Give us an example of one of the scams that...
Well, there's the sweetheart scam, which he had several clients who go on a dating site and fall for somebody, think it's a real person, and we recently had someone that lost $50,000 sending money to some person she thought she was helping and connected with in a relationship. We also have people calling and pretending, that they're going to do COVID-19 related services that don't exist, and they just try to get their information.
Did you hear about the one where the scammer called the patient and the aide intervened, and somebody was saying that they were like the grandson arrested for a DWI?
Oh, that's a common one, though.
Yeah, but thank God the aide was there, though.
The grandparents
yes,
scam,
that's yeah. I have a question, though. When you're talking about financial support systems and stuff, so if someone is in need of services in their home, but they really can't afford the services, I know that they're going to be, or in the midst of transitioning over to managed long-term care Medicaid, does your office assist with that as well?
We do. The ISEP program, which is funded through New York State Office for Aging and the Nassau County Office for Aging, provides case management and in-home assistance, and they can get up to 20 hours of home care in their home. And it's on a cost share basis based on your monthly income and your expenses. But I'd say if you make $1,500 a month or less, you're probably going to pay $0 for 20 hours a week of home care.
And does that 20 hours stay with them if they get on Medicaid as well?
No, it's for people that are above the Medicaid level, so that once they're on Medicaid, they can get their home care covered.
But you can't get both. So if
you can't get both.
Okay. So if someone had 25 hours a week through the managed long-term care, they couldn't get additional services if they needed through your program.
No, we assume that they would be getting the services they need through the Medicaid program, and that's something that our case managers do. They help seniors assess their situation. We try to educate them on what is out there and what they can connect with and what's the best resource for them.
Understood. What about, do you help people apply for community Medicaid?
We do.
Okay.
We
and you do the application with them?
Pre-COVID, we were dropping it. We were helping seniors gather their documents and dropping it at the Department of Social Services. Now we do it online.
The other thing is I see a lot of seniors who are at home and have difficulty getting all their bills and everything paid. How do you help this segment?
We have a wonderful volunteer program at FCA. It's called the Bill Payer Program. And they have volunteers that are trained and background checked that go visit seniors pre-COVID once or twice a month to go through their bills with them, help them write their checks out because seniors might have visual issues. So they help them with that. You do have to understand your bills, and you can have dementia and be eligible for that program. But it also helps them to organize their mail and organize their documents. And during COVID, we were doing a bag program where seniors actually put their information into a bag. The volunteer would go to the home, would sometimes sit in the car, sometimes work it that way, and then drop it back to the senior.
Wow, excellent.
Yeah,
all good information.
Yeah,
for us.
very good. So is there an intake department, or how does someone access this type of help?
You would call 516-292-1300, and you would talk to the person who answers the phone or leave a message, and someone gets back to you within the same day.
What is the length of time from the time of intake till they actually starting to get some help?
That's a great question. Usually within 1 to 2 weeks, you'll get assigned a case manager, and that person will follow up with you. For senior financial counseling, there is a wait list, I believe, for the Bill Payer Program right now. But we also prioritize. So if somebody is in an emergency situation, that makes a difference. Someone's frail, someone's 90 plus, someone has limited support system and limited income, that becomes a priority client.
Do you guys offer legal services as well and guardianship?
We do not, but we do work with Nassau Suffolk Law Services. If someone needs a pooled trust for managed long-term care, our bill payers do help manage the trust on a monthly basis once it's set up.
So what about Alzheimer's? Do you have a specific program to help with families?
do.
You do? Okay.
Tell us.
We have our Alzheimer's caregiver support. We're actually through the Department of Health, and now we're going to be partnering with Parker Jewish as well. Our program really targets the underserved communities, but we do have a counselor that was making home visits, now does telephone counseling or online counseling.
Is that a choice that your office made, that there's no in-home visits? Because I just don't know the effectiveness when you're not in the house. Like, we go into the house, we're nurses, we go into the house.
Yeah.
When is it going to be that they have their home visits again?
It's to protect the clients, but we do it on a one-to-one basis. So if we think someone needs a home visit, we will find a way to visit them if necessary. But it's more to protect the clients because we don't want to expose them.
So Lisa, I think that's excellent information. And they can also get us to visit them, home visits
Yes.
through a physician to help them out and work with you. That's it for our show today, letting us take care of your loved ones at home. Follow us on Facebook and Instagram, allthingshomecare.org. See you next time on the Dana and Dr. Pearl Show.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.